are continuing our Heart Healthy theme show, and we're going to talk more about the risk and warning signs and prevention. We're also going to learn the proper way to administer CPR. Joining me now from Yale-New Haven Hospital are Dr. John Forrest, the director of the Structural Heart Disease Program, and Dr. Sharon Chakijan, an emergency physician. Doctors, thank you so much for being here. Dr. Forrest, let's start with you. We talked a little bit about the risks earlier in the show, but how big of a role does family history play in heart disease?
It certainly plays a significant role. There are risk factors we can control, like smoking, our cholesterol, and our blood pressure, and there's some things we can't control, like our family history. We're born with the parents who we're born with. When you're looking at your family history, what you want to look at is your first-degree relatives first, your mother, your father, your brothers, and your sisters. And if any of them, if they're male, have had an event before the age of 55, we consider that a significant event and a positive family history.
Okay.
If it's a female, so if it's your mother, we say if she's had an event before the age of 65, that it's significant. If both your mother and father have had events before the age of 55 for your mother, 65 for your, before the age of 55 for your father, 65 for your mother, that can increase your risk up to 50%.
Wow, so you better, what would you do in that instance?
So just because your risk is increased doesn't mean this is going to happen to you. When you have a strong family history, it's even more important to pay attention to things like your blood pressure, your cholesterol, what you eat, making sure that you exercise regularly. And if you do those things, you can mitigate your family history.
Okay.
Similarly, things like blood pressure, high cholesterol, diabetes can run in families, and so often your parents will have had those. They may not have taken as good care. We've learned a lot more in the last 15 and 20 years than we knew before. And so by taking medications, by seeing your doctor regularly, checking your blood pressure, checking your cholesterol, you can decrease your risk significantly.
Take the precautions, right? You
Exactly.
could save your life. And Dr. Chakijan, in the emergency room, what are you saying when people come in?
So we're usually seeing people at the end of the disease process, or when they've failed to actually prevent their risk factors.
They're having a heart attack.
Influencing their health. They're having a heart attack, and as Dr. Forrest said, prevention's really the key. So knowing your numbers, knowing your risk factors ahead of time, so you don't get to the point where you're coming into the emergency room with chest pain is really the key.
Okay, well, let's talk a little bit about CPR in case we do need to save a life.
Sure.
Obviously, you want to take a course in the community, but give us the basics here, doctor.
So there's some exciting things going on with CPR that I just wanted to bring to you and to tell you about today, and it's going to be really easy to learn it. CPR has actually changed in the last several years. The recommendation for bystanders out in the community are completely different. So just a word about CPR and when you would use it. It's not just for your run-of-the-mill heart attack. So if somebody's clutching their chest, you're not going to run over and start CPR. But if they collapse or have a sudden cardiac arrest, that's when you want to intervene. We have about close to 400,000 cardiac arrests per year in the US, and there's a very low survival rate, about 8%. And believe it or not, that's highly variable depending on what community you live in.
Really?
So communities where people have been trained in CPR out in the world, not just in the emergency room, have really improved their rates of survival. So it's important to know, especially if you live with somebody with heart disease.
Sure, you could save a life.
You could save a life. Actually, about 88% of cardiac arrests happen in the house, so it's probably going to be somebody you know if you are saving a life. So if you want to just come over.
Show me how we do this.
So the new recommendations are actually a little bit different from before. We're not doing the 30 compressions and 2 breaths anymore, which is the standard.
That's what I learned in high school. It's been a while, huh?
So if you're a bystander, if you're not a medical professional, you actually get a break now.
Okay.
All you have to do is do compressions, and the key is hard and fast. Okay, we always tell the residents and our people in training to do it to the beat of staying alive. So you want to be compressing at about a rate of 100 beats per minute.
So that's pretty fast. Okay.
It's fast, so hard and fast. And what you want to do, if you want to come over here, is get the patient in a position where you can extend your arms fully. And you're going to extend your arms straight out so that your elbows are pretty much locked.
Okay.
You're going to put your hands right in the center of the chest, and you're going to depress hard and fast. And what you want to do is depress about 2 inches down. So it may feel very extreme to you.
Should I give this a shot here?
Give it a shot. Just hands straight out, and you can use one to balance the other. You'll be tired very quickly. So have somebody else call for help, or call for help first.
But you no longer have to pinch the nose, tilt the head back.
You don't have to worry about any of that. Of course, if you are formally trained in CPR, it's always a good idea. If you have a different protocol to follow, that's fine, but you do get a bystander break as of the last recommendations that came out. It's just compressions only now. And I think that's really helpful because a lot of people are very fearful, especially if they don't know the person, about making mouth-to-mouth contact.
Good
So
point.
this has really improved rates of compliance and improved the rates of survival.
Very good. It's easy to just learn. It's probably a course, right? And
It's easy. I mean, that's it. If you really can remember hard and fast and staying alive, I think
that'll do it.
you'll be good. But
All
if
right.
anybody's interested, of course, there are always online courses and community courses as well.
Very good. Thank you so much, Dr.
course.
Forrest. Thank you for the advice. And if you need more information on Yale-New Haven Hospital, you can see the address on your screen. You could also visit them on their Facebook page. And stay with us. More Connecticut Style after the break. We'll be right back.